not all drugs may be weak acids or weak bases, but some drugs, or quite a number of the drugs we give, are weak bases or weak acids. And if they are weak bases or acids, the state in which they would be in order for them to be absorbed would be influenced by the pH of the medium. And so I would not illustrate this here. I'll rather illustrate it in our next slide where we talk about the pH of the medium. So now pay particular attention to what I'm going to do. Let's say that this is our medium in which the drug finds itself. The drug needs to cross to circulation. Now, if the drug is acidic, for an acidic drug, the drug may be illustrated this way, HA, and in physiological solution, it dissociates into H plus and then A minus, that is the anion. Now, the actual drug would be the anion, okay? So an acidic drug, I have this species here, the HA, and then I would have some of the H plus, and then I have some of the A minus, okay? Now, if this acidic drug is in an acidic medium, so the pH is in the acidic range, acidic medium, okay? Normally, the equilibrium will shift to favor the drug that is not ionized, the unionized form. That means that it will not be charged. Now, remember, I've told you that if the thing is not charged, it easily can be absorbed. And so when you have an acidic drug that is in an acidic medium, majority of the drug molecules will be in the unionized form, which is the HA. So that unionized form can easily cross into circulation. So let's relate it to the body. In the body, the stomach is acidic, right? So if I gave you an acidic drug, that drug's absorption will begin from the stomach, because in the stomach, you would have majority of the molecules being in the unionized form. So from the stomach, you can cross the stomach lining and enter into circulation. The next thing is that if I have an acidic drug, but then that acidic drug is in a basic medium, it's in a basic medium. So I have an acidic drug in a basic medium. The equilibrium will shift to favor the charged form of the drug. So we have more of the charged form than and less of the unionized form. Now, if we have more of the charged form, then it means that it is going to be difficult for such a drug to easily cross the cell membrane into circulation. But this is not the only factor that will determine. So as I said, an acidic drug in an acidic medium will start its absorption in the stomach. But because the stomach does not have a very large surface area compared to the small intestine, the acidic drug will still have to go to the small intestine for majority of it to be absorbed. So this is how you look at it. Now let's flip this same scenario around. You have a basic drug. You have a basic drug. Let's represent it with BOH. It dissociates in solution to produce B plus and then OH minus. The B plus is the drug in solution. Now, if such a drug is in, so a basic drug, I have the BOH goes to B plus and then OH minus. Now, if such a drug is in an acidic medium, the equilibrium would favor the charged form of the drug, the B plus. So we have more of the B plus. So meaning that since it is charged, it will be difficult for it to cross membrane. So basic drugs do not cross into circulation when they find themselves in the stomach. But then when you pick, let's say, a basic medium, the equilibrium will favor the uncharged form of the drug. So that drug would cross into the circulation easily because it is not charged. It can easily cross the membrane. So I think that this is simple enough to understand. So this is how pH would affect the medium. But one thing I want you to understand is that it is important to keep in mind that you cannot pick one factor in isolation. We would have to look at all the factors together in order to decide on whether the drug gets absorbed well or not. So the pH will be one, the physicochemical properties is another. You need to put all of those things together to decide on how the drug gets absorbed. The next factor we want to look at is the route of administration. Now, if you pick route of administration, we can consider routes like the oral route, the intravenous route, the intramuscular, subcutaneous, and intrathecal. We can have transdermal. So there are so many routes. Could have sublingual and all that. Now, depending on the route we use, we are either going to have the drug absorbed well, or it may be absorbed slowly. So let's pick the oral route and use that for illustration. If I were to give you a drug orally, this drug would have to go through the esophagus, then enter our stomach, all right? Go through the stomach before it enters our small intestine. Now, majority of the drug obviously would be absorbed from the small intestine, but if it's an acidic drug, absorption will begin from the stomach, like we said. Now, it is possible that whilst the drug is going through all of these processes or these movement, it may get to the intestine and probably some enzymes would have destroyed the drug before it even gets absorbed. So you have a reduced amount that gets absorbed. It's also possible that acid content in the stomach can destroy some parts of the drug before some of it gets absorbed. So by the time an oral medication gets absorbed, sometimes you would have reduced the amount that is available for absorption. So most often drugs that are orally administered, the absorption may not be as fast as we would want, and it may be not completely absorbed, okay? It's possible that certain things in the stomach and the intestine affects the rate of absorption. So that is going to be a problem if you want all of the drug to be absorbed. There are exceptions, though. There are some drugs you can give orally, and then the absorption is complete. Okay, so that may not be a problem. But if for most drugs, when we give them orally, the absorption is usually quite slow as compared to, let's say, intramuscular or subcutaneous. Then you may also think of the intravenous, where there is no need for any absorption because the drug is administered directly into the circulation, systemic circulation. We come to blood flow to the site of absorption. Now, when we need absorption, so let's say if this is the medium in which your drug is, and this part is your circulation, the drug needs to be able to cross into circulation. Now, if blood flow to the area where we need to have the absorption is good, this would enhance how much of the drug gets to transition from the site to circulation. But if blood flow reduces, then circulation would also, since circulation has reduced, it means that the transitioning of the drug molecules into circulation is also going to reduce. Let's pick a scenario. A patient with shock, or a patient in shock would normally have blood flow to cutaneous sites reduced. Okay, when I say cutaneous sites, we are dealing with blood flow to the skin. So let's assume that I gave you a drug that is subcutaneous. Subcutaneous. Or we just write SC. Now, since we've given the drug underneath the skin, we would expect that it will cross certain barriers in order for it to get into circulation. But since blood flow to the skin in that patient with shock has reduced, it means that the drug moving into circulation would be impaired. So for such a person, if you are not aware of it, it means you may give the drug and the drug may not work to address the shock situation. So these are things that you need to know in order to make decisions for the patient. Then we come to available surface area. Earlier, I was trying to compare stomach and then the small intestine. And I was saying that the stomach's surface area is smaller as compared to the small intestine. And so if I gave a drug, because the small intestine affords us with a higher or a greater surface area, we would expect that more drug gets to cross as long as other conditions are good enough. The drug molecule should be able to cross into circulation easily as compared to the stomach. So even though, like we said, acidic drugs will start the absorption in the stomach, because the surface area in the small intestine is quite high,